This is the history of mankind. One of the scariest viruses I've ever encountered. Its fatality rate once reached a terrifying 90%. It even caused patients to die too quickly. And outrageous situations that cannot be widely disseminated. Within 2 weeks of onset of illness, there will be massive bleeding in all organs of the body. Eventually died from multiple organ failure. It's the Ebola virus known as the eraser of life. The name originated from Africa, a river in the Democratic Republic of the Congo. And how he was first discovered. It's even more dramatic. One day in September 1976, Belgium, in the laboratory of the Institute of Tropical Medicine, Antwerp, an ordinary thermos flask was brought in. 27-year-old young scientist Peter Piot. I was on duty in the laboratory that day. He opened the thermos and took a look. It's not coffee, but in a few melted ice cubes, soaked in blood, and a handwritten note. Note is a Belgian doctor working in Zaire. Written explanation. This is a Belgian nun who suffered from a mysterious illness. The blood sample is incredible. This package was packed in a passenger's carry-on suitcase from Kinshasa, the capital of Zaire, brought on a commercial flight. In today's view, this is simply a bold move. Order and his team start testing this blood sample immediately. On October 11, they use electron microscopy. A filovirus was observed. This virus looks like a snake. After consultation and confirmation with experts from around the world, he realized it was a new virus that had never been seen before. It's just that at this time, Piotr couldn't think of it. Once this virus spreads, enough to destroy all mankind. I'm asking to the end. A medical blogger who specializes in in-depth science popularization. Then, why is Ebola virus called the king of viruses? So, how is it so terrifying that it was contained by humans? Let's start today's popular science together. Let's start from the beginning. Just when Piot discovered a new virus, bad news has come. The nun has died. And in the remote areas of northern Zaire, many people are dying from the same mysterious disease. Symptoms include fever, diarrhea, and vomiting. Then bleeding all over the body. Final death. Realize the horror of this virus. Piotr, who has never been to Africa, defies public opposition. Boarded a flight to Kinshasa 2 weeks later. Later, as Piotr recalled, it was an overnight flight. I can't sleep at all. To see Africa for the first time. Study the new virus. Extremely excited to stop this pandemic. Arriving in Piot in Kinshasa. Joined a multidisciplinary investigative team. Start exploring the source of this epidemic. Took months. The source of this horrific plague has finally been revealed. First patient. It's northern Zaire. A 44-year-old primary school principal in Yabuku village. Mabalo Rokara. He completed a trip and returned to his hometown at the end of August. Along the Ebola River. Traveled to the border areas of the Central African Republic. At first he had a fever. Diagnosed with malaria by Yabuku Mission Hospital. The doctor injected him with quinine. Symptoms relieved. However, September 1. Rokara returned to the hospital again with a high fever. The doctor advised him to go home and rest. Until September 5. Rokara's condition is already very critical. Bleeding occurred all over the body. Severe vomiting. Severe diarrhea. Symptoms such as chest pain, headache, fever, and confusion. Finally died on September 8. The disaster began to spread. According to local traditional customs, Rokara's wife and mother-in-law and sisters, along with other female relatives, preparing for a funeral. But no one knows. During the process of cleaning Rokara's body, the virus has spread rapidly among his relatives. Shortly after the funeral, all 21 of Rokara's relatives and friends fell ill. 18 of them died. What's worse, Yabuku Mission Hospital is a remote Catholic hospital. No doctor. There is also no laboratory equipment to help diagnose. Due to lack of communication facilities, the hospital is almost completely isolated from the capital Kinshasa. According to the records of Piot's team, the outbreak ultimately infected 318 people. 280 people died. The fatality rate is as high as 88%. Since the first case appeared near the Ebola River, the new virus was named Ebola virus. Same period. Nzara in southern Sudan. Another outbreak also occurred. It was later confirmed. Are caused by different Ebola virus subtypes. 2 epidemics in 1976. This is the first time humans have recognized this terrible pathogen. Later scientists speculated Rokara may have been during her travels, purchased and consumed virus-laden monkey meat, or antelope meat, and infections in many parts of Africa. People have hunted chimpanzee monkeys, wildlife such as antelopes and bats, Custom as food. This type of meat is called bushmeat. Bushmeat is susceptible to viruses. Possible human infection with Ebola. One of the sources of hemorrhagic fever. Nearly 40 years later. Ebola virus outbreaks in Africa. But the scale is relatively limited. Until the end of 2013. An unprecedented disaster is brewing. December 2, 2013. Mariando village in southeastern Guinea. A man named Emilwa. Muno's 2-year-old boy falls ill. Fever first. Then started vomiting violently. With projectile diarrhea. There is blood in the stool. No one in Mariando has ever seen similar symptoms. December 6, only 4 days after becoming ill. Little Emil passed away. His family tried their best. Take care of. He didn't know that he was walking towards death step by step. Soon Emil's 4-year-old sister, Philomena, had the same symptoms, and were followed in death by the boy's mother and grandmother. Not long after, a midwife in the village passed the virus to relatives in another village, and the medical staff who cared for him. That medical staff, while receiving treatment at a hospital in Macenta, infected another doctor. The doctor then reported the virus, sent to a distance of 133 kilometers. Brothers of Gishi Tugu. 4 months after Emir's death, 14 residents of Mariando village buried. Researchers later speculated, Emir, most likely while playing near a hollow tree. The infected tree, found to be the habitat of the Angora's whole-nosed bat. This bat carries Ebola virus but doesn't get sick. An accidental contact with this 2-year-old boy, triggered in human history. Worst Ebola outbreak. Because local doctors initially mistook it for malaria, or common diseases like cholera, until March 25, 2014. That's 12 weeks after the first death. Guinea health officials confirmed a total of 86 suspected Ebola cases. March 30, neighboring Liberia. 2 cases imported from across the border were also confirmed. The epidemic is starting to get out of control. The epidemic spread to Guinea, Liberia and Sierra Leone. Become the history of Ebola hemorrhagic fever. The most serious outbreak. This is also the first time the disease has arrived in West Africa. Until the epidemic is over, a total of more than 28,000 infections have been reported. More than 11,000 people died. Cases and deaths, exceeding all previous epidemics combined. In this war between humans and viruses, medical staff are on the front line, paid a heavy price. In 3 affected countries in West Africa, a total of 507 medical staff. Death from Ebola infection. One of the most harrowing stories. It was the sacrifice of Sheikh Umar Khan. Khan is Sierra Leone, the top doctor responsible for containing the country's Ebola outbreak. Before getting Ebola, more than 100 patients have been successfully treated. July 2014. Unfortunately, Han was infected with Ebola virus. The 39-year-old doctor passed away on July 29. His death has given a huge impact to the fight against the epidemic in West Africa. Brought a huge blow. December 2014. Nature magazine named Han among the top 10 important people of the year. 2019. An asteroid named Sheikh Umar Khan. To commemorate his contribution, our country was also the first to respond to the call from affected countries and the World Health Organization. 4 rounds have been provided. Emergency assistance worth a total of 750 million yuan, and dispatched medical teams to affected areas. So after telling the story of Ebola, now let's look at it scientifically. Come and meet this formidable enemy. Ebola virus belongs to the family Filoviridae. Approximately 1,000 nanometers in length under an electron microscope. About 70 to 90 nanometers in diameter. It is genome size. Single-stranded RNA of approximately 19 kilobases. Virus. Encodes 7 structural genes and 2 non-structural genes. Has a lipid envelope. Viruses come in various forms. Mostly filamentous or rod-shaped. There are branch type, U-type, 6-type, or ring type. Branching type is more common. The surface of the virus has neatly arranged brush-like protrusions. It is precisely because of this unique snake shape that, or silky appearance, the family of viruses to which it belongs, was named Filoviridae. 6 types of Ebola viruses have been discovered in humans so far, including Zaria type, Sudan type, Reston type, Thai forest type, Bundibu suburban, and Bomali, first discovered in bats in 2018. Virus. There are differences in the biological properties of different subtypes, Zaria type and Sudan type, to humans and non-humans. Primates are most pathogenic and lethal. Gautai forest type is obviously pathogenic to humans, but usually not fatal. Reston type is not pathogenic to humans, only for monkeys and other non-humans. Primates are lethal. Bomali virus. It is unclear whether it causes illness in humans. About the natural host of the virus. The scientific community generally agrees that it is Hufuco's fruit bat. Serological studies have shown 3 African bats, hammerhead bats, Fuji house bat and small ridge bat. Serological evidence of Ebola virus infection in the body. But these bats showed no symptoms. They may be natural reservoirs of viruses. Bats can carry 60 viruses. 59 of them are RNA viruses. The virus can spread when people are in close contact with infected animals. Enter the human body. These animals include sick or dead fruit bats, chimpanzee, gorilla, monkey, forest antelope or porcupine, etc. After the virus is introduced into humans, then the terrible process of human-to-human transmission begins. Through direct contact with Ebola patients, people can, or the blood or body fluids of a deceased person. It may also occur through contact with objects contaminated with body fluids, or surface infection. People infected with the virus. Disease can only be spread after symptoms appear. As long as the virus is present in their blood, they will remain contagious. The incubation period of the disease is 2 to 21 days. Symptoms may appear suddenly, including fever, fatigue, discomfort, muscle pain, headache and sore throat, vomiting, diarrhea, abdominal pain, rash followed, and symptoms of impaired kidney and liver function. Although bleeding is considered a common symptom, but it often occurs later in the disease. Some patients may experience internal and external bleeding, including blood in vomit and stool, and nose, gum, and vaginal bleeding. Effects on the central nervous system can cause confusion, irritability, and aggression. Borovirus can attack the human body, except for bones, all internal organs and tissues except muscles and bones. The virus spreads rapidly in the body, breed in large numbers, attacks multiple organs, cause degeneration and necrosis, disseminated intravascular coagulation, eventually due to multiple organ failure, death due to brain damage, etc. The average case fatality rate of Ebola is about 50%. In previous epidemics, case fatality rates range from 25% to 90%. Clinically, Ebola is difficult to distinguish from other infectious diseases, malaria, typhoid, meningitis, and other viral hemorrhagic fevers, because the early symptoms of the disease are similar to. Confirmation requires laboratory testing, includes reverse transcription polymerase chain reaction test, antibody capture enzyme-linked immunosorbent assay, antigen capture assay, and virus isolation and culture. Because filamentous viruses have a unique insect-like structure, can be identified by electron microscopy. However, this method cannot further identify specific species. Samples collected from patients. High biohazard risk. Laboratory testing of non-inactivated samples should be conducted under the highest level of biocontainment conditions. The biosafety level of Ebola virus is level 4. This is the highest level. The AIDS and SARS viruses we are familiar with, only level 3. Faced with such a terrible virus, research and development of vaccines and specific drugs has always been the direction of efforts of scientists around the world. The good news is, after decades of research, humanity finally made a breakthrough. Back in 2003, American scientist Heinz Feldman and colleagues from the National Microbiology Laboratory of Canada start developing a vaccine based on vesicular stomatitis virus. Vesicular stomatitis virus, surface protein genes, replaced with Ebola virus genes. A recombinant virus was obtained. In 2005, researchers demonstrated that monkeys who were exposed to RVZ first, in what should have been a deadly Ebola attack, survived. However, the cost of developing this vaccine, estimated to be approximately $1 billion. Pharmaceutical industry, for producing a prevention only in poor countries. Vaccines for occasional diseases. Not interested. The turning point came after the outbreak in West Africa in 2014. World Health Organization holds meeting. Given the huge danger posed by the Ebola virus, try experimental vaccines and treatments. Is a moral imperative. 2015. Clinical trials of this vaccine begin in Guinea. As part of a ring vaccination strategy, that is, every contact of a case, and providing vaccines to contacts of these contacts. About 12,000 people were ultimately vaccinated. The protective efficacy measured at that time was 100%. In 2018-2020, Ebola outbreak in Eastern Democratic Republic of Congo. Ring vaccination is used on a large scale, based on real-world effectiveness research, among individuals who were vaccinated at least 10 days before exposure. Vaccine is 84% effective against Ebola virus disease. April 2019. The World Health Organization released research results showing that RVZ vaccine effectiveness in stopping the spread of Ebola reached 97.5%. October 2019. European Medicines Agency recommendations. RVSV's Debov vaccine approved. November 2019. World Health Organization. First test of an Ebola vaccine. Pre-qualified. Demonstrates that the vaccine meets the quality, international standards for safety and effectiveness. This is the history of mankind. First Ebola vaccine to receive regulatory approval. Marks a historic milestone. As scientists involved in vaccine development said at the time, analyze on multiple levels. This vaccine was never possible. But he just keeps moving forward courageously. I succeeded in every possible way. In the treatment of drugs. Major breakthroughs have also been made in. End of 2018. World Health Organization in the Democratic Republic of the Congo launched a project called PA. Large randomized clinical trial of LM. A total of 681 patients were enrolled. Evaluating 4 therapeutic antibody cocktails ZMAP. 3 monoclonal antibody mixtures REGN-EB3. Monoclonal antibody M. AP114 and the antiviral drug remdesivir. The results are encouraging. After 28 days of treatment, the mortality rates of each group were 49.7%, 53.1%, 35.1% and 33.5% respectively. Treat early after infection. And among patients with lower blood viral levels, the data is even more shocking. The mortality rates dropped to 24.5%, 29.0%, 9.9% and 11.2% respectively. If patients can receive RAGNE as early as possible, B3 or MF114 treatment, survival rate can be as high as 89% to 94%. This means Ebola mortality rate increased from 67% during the overall epidemic, can be significantly reduced with effective antibody treatment. Looking back at the nearly half-century history of Ebola virus, what can we learn from this? Compared to the time when humans were born, most viruses and bacteria on Earth, maybe he is the master of the Earth, has existed for hundreds of millions of years. But humans have always lacked respect for nature. Ebola virus, still lurking in the tropical rainforests of Africa. It may break out again at any time. Currently approved vaccines and treatments only for Zaire Ebola virus. Target other virus subtypes. Vaccines and treatments for Sudan virus under development. Just like 2022, Uganda breaks out. Outbreak caused by Sudanese Ebola virus. Because existing vaccines are not effective against this subtype. Another 55 people died. It has sounded a new alarm bell for mankind. This also proves that human beings, the fight against these ancient enemies, just the beginning. Thank you everyone for watching today's video. If you find it useful, please like, retweet and follow. See you next time.